My life be like, yeah. My life be like, yeah. Yeah. My life be like, yeah. My life be like, yeah. My life be like, yeah.
It's Speak It Thursday, and I'm back. It's your girl, Shuli, and it's time for another conversation. Happy Thursday to everyone. Thank you for those people who are tuned in and taking your virtual seat. As you come in, just talk to me. Let me know how you're doing. Drop your city. Let us know where you're tuning in from. And make sure you share this so you can invite some other people. We have a doctor in the house, so I hope you have your questions ready. Get ready to learn. World Voice Day was April 16th. Or was it? I'm at this point, my memory is so bad. Was it the 17th? But anyway, so I call it Voice Month. Okay. So, as you all know, that I am a speech pathologist, voice specialized. And of course, this is kind of like an after dark platform. But when it's voice, anything to do with voice, and then May is Better Hearing and Speech Month, we are talking about communication. That's what this is all about. We know that when we speak it, it's about the ashe. We have the power to create or destroy with our words. So we choose to create. Our words have power. So as you tune in, we are going to get this show started. This conversation starter that we have tonight is awesome. I have to say, she is a female doctor. She's a Black doctor. She's a mom. She's a wife. She's an all around superhero. But what we're having her to talk about tonight is the fact that she is the voice box doctor. Okay, she is a surgeon. Dr. Sandra Stinnett is a laryngologist, and most of you have heard of ENT, ear, nose, and throat specialist, but she's an assistant professor and director of the Division of Laryngology at University of Tennessee Health Science Center in Memphis, Tennessee. And I'm going to take a breath. And Dr. Stinnett is passionate about creating awareness for vocal hygiene and prevention in the Memphis community. So we're happy to have her here tonight. And she provides state-of-the-art care in the ear, nose, and throat field. She is providing excellent medical care for the core of your soul. So when she comes on, give her a speak it welcome by likes and hearts. Welcome to the Speak It Couch, Dr. Sandra Stinnett.
Thank you so much, Shirley. Thanks for having me. This is such an honor to be here to chat with you today about both of our passions.
Yes, it is a pleasure to have you. I came across your profile on Instagram, of course, just through another speech pathologist, I believe. And I was like, oh my gosh, I love your videos.
Thank you. Thank you so
Yes.
much.
She's a TikTok sensation, you all. And the video that you saw playing as you were taking your virtual seats, she was showing us something very special. So talk to us about what they saw in that video.
So those were vocal folds. They're not mine though, so I perpetrated on that video. You see my large tonsils, those are mine. I need to get them taken out, but that's another story for a different day. But basically for me as a laryngologist, and even for usually a lot of speech language pathologists that specialize in voice, oftentimes do a laryngoscopic exam. Ours is a little bit more specialized where we do a stroboscopic exam, where it's a strobe light that basically flashes to the frequency of the voice. So, you speak and then the light kind of syncs with your voice, and that basically slows down the wave of the vocal folds, and that allows us to visualize any lesions on the vocal cords or any abnormalities in the wave itself can kind of trigger us to look at different pathologies. So it's a pretty neat way to get a lot of information about the vocal cords and their delicate and intricate physiology. So those
Definitely.
Yes.
Definitely. And of course, people who use their voices to make a living are professional voice users. And I like to call them vocal athletes. And of course, we know the LeBron Jameses in the world, they warm up and they have a regimen, but many voice users jump on the stage and they prepare their materials, or whether you're a podcaster, a singer, I would
Right.
say even a teacher, right? Talk
100%.
to us more about professional voice users and the kind of care they need to take for their voices.
Right. So, what's great is that at least singers, from my experience, are very knowledgeable about the care that they need to take for their voice. I mean, they get that through their vocal training, and so that's wonderful. The interesting thing is professional voice users, whether you're a podcast host like yourself or teachers, really don't have any vocal hygiene programs that they could tap into to understand not only the importance of, but what to do as a vocal warm up. So just as we warm up when we're about to work out, like you said, LeBron James, and even cool down, it's important for us to really stretch out the vocal cords and get them warmed up for the marathon that we're going to run. So, a few exercises. I just put it, I put it before logging on to speak with you today. I put it on my Instagram stories, the lip drills. They're so funny. It's just funny to do, but they make a big difference. So if you just do the lip drill like you're doing raspberries, or like a siren, my husband has, he's a singer, so he does do a very good warm-up regimen, and you could probably find some on YouTube, but just some chords with some pharyngeal, nya, 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 and just going up and down the chords, and then getting your day started, listening to your body throughout the day, take incorporated rests, and then at the end of the day you have to cool down. The same exercises are what you do to cool down too, so you get some longevity out of those vocal cords by doing that.
Most definitely. One of my favorites, of course, would be lip trills. I must admit this, the tongue trills, I have not mastered those yet. I definitely think I have too much tongue tension. But
Right.
water, I have my water here too. How
I'm
do you feel about the straw phonation? Are you into that at all?
I think there's utility for it. So I always defer to the speech language pathologist that I work with in my clinic, Amy Neighbor. She's a classically trained singer, and then she also specializes in voice. So she does do straw phonations, and like I guess it's the semi-occlusive techniques and things like that for the right
Mhm.
patient. She has a lot of other tricks in her bag too that she's able to do too. I I think particularly though during COVID, we're all wearing these masks, and Dr. Reena Gupta out of LA, she was talking about how she noticed her voice volume was up 20 dB from her normal speaking voice, and she felt tension, and I mean we all probably do, and so she was teaching how to do a variation of the straw technique in order to eliminate that tension. So there's utility, especially now with the mask phenomenon of
I
creating more
know.
tension.
Now
It's
more than ever. Talk
right.
about that a little bit. So have you seen or noticed any trends during this pandemic with the voice users and due to the mask or whatever? Speak on that a little bit.
Right. So there's a lot of muscle tension that I'm noticing now. I'm seeing a lot of teachers with a lot of muscle tension. I'm seeing a lot of teachers with functional dysphonia where, they don't necessarily have any lesion on their vocal folds, but they have this horrific dysphonic voice. And they just cannot coordinate those vocal folds to work together to make a,
Yeah.
nice resonant voice. And so, that might be the mask, stress induced, obviously, as well as a possibility, or a minor URI infection or something. But
Mm.
those
So
are
talk about that. You're saying some words. So you said dysphonia. So talk for the audience who, they're not familiar with
right.
that. So what is dysphonia?
Sorry, I felt like I was talking to you because
I mean, I feel you.
that's right, right. But you're right. So sorry, everybody. Dysphonia is just basically it's easier to call it hoarseness, but hoarseness is more of a catch-all term. So dysphonia, quite literally just means an abnormal voice, whatever, if it's hoarse, if it's raspy, if it's strained, if it's, whisper, or just you can't make a sound, period. So dysphonia is just any abnormality or perturbation in your voice.
Okay, very good. And then you said URI. What is that?
URI is upper respiratory tract infection. So, like a little runny nose, just a common cold, runny nose. Any symptoms like allergy symptoms as well are similar and can be contributory. Itchy throat, watery eyes, just things of that nature that can cause you to be congested and have a significant impact on the quality of your voice as well. So,
Definitely. And like you said, I noticed coming through my virtual doors because I've been virtual since last year in March. It
yeah.
was weird going into the office and seeing the calendar was still on March. Like I never changed it in the times I had to come in and out. But I've had a lot of referrals for, like you said, muscle tension, dysphonia, and so much. I don't know, just working with the clients in therapy, right? They ignored it for a long period of time, and
Right.
that's pretty common. What do you have to say to people who have been having these experiences with hoarseness and things like that for an extended period of time?
So yeah, no, I've been noticing the same thing, and it's unfortunate because I can't say that I'm not guilty of ignoring medical issues, but when it comes to the voice, muscle tension is a little bit more forgiving, but if you do have a lesion on the vocal folds, that could be an issue. And, you want to make sure that you don't, especially if you are a professional voice user. And quite frankly, we all use our voice every day. So in essence, we're really all professional voice users. And with the virtual world now, we're probably all vocal athletes are heading that way. So, if there are any abnormalities or any diminished vocal endurance, it's important for you to get it checked because there's a book that I'm reading. It's called This Is the Voice. And I forgot the author. I think it's Calatino. Anyway, he's a singer. And he kind of touches upon the fact that any manipulation or changes in the voice or anything affecting the vocal folds, whether it's tension or a lesion, it can mess with the prosody of your voice. And so that just
Oh, for
basically
sure.
means like for somebody who's very sing-songy and like has a lot of intonations in the voice and hello, how are you today? And if you're hoarse and you're like, hello, how are you today? People are gonna think like, whoa, is she like in a bad mood? When you're not, you're just having some pathology going on in your voice box that needs to be addressed. So, the voice really transcends so many levels. It's not just about communicating effectively, but it communicates emotion. It basically is the essence of who you are. It's your personality. So if we hurt our knee or we have a cavity and we get that fixed,
Mhm.
why not, be as diligent about getting your voice checked? You never know.
Oh my gosh, yeah. So that brings up so many things. And so while we're in this time, we're on Zoom a lot. Like you said, we're wearing masks. And I think that was in our ASHA Leader, which is the publication for speech pathology. They were saying that we were told to, right, social distance. There's 6 feet of distance between people, but wearing a mask
Right.
was the equivalent of having 12 feet
Right.
between you and your communication partner.
Right.
And what I've noticed, people have had changes with their jaw posture.
Right.
So maybe more tension in their jaw
Mhm.
and just changing their breathing patterns. So many things are going on with that,
Mhm.
added to the stress of being out in these streets and trying
Right.
to navigate your world.
Right. A hundred
It's a
percent.
lot. So we have, hi there, Warren Stinnett. Any relation from Corinth, Texas?
That is my amazing father-in-law. So hi, Dad.
Welcome to the Speak It podcast. So, as we're talking about that, and you're saying that our voice definitely is the vehicle of our emotions, and on your site, I saw you said I presume you were referring to the voice, the core of your soul.
Right.
Talk to us about the thing that matters. So, our soul matters, our voice matters. Talk
Right.
to us about the connection to the voice and the soul.
Okay. So it's a personal story that I actually told my speech language pathologist this story, and she thought it was a great story. So we'll see if it resonates with you as well. Um, So when I was a kid, for some reason, I felt like the soul was in the chest neck area, just breathing, speaking. I felt like that was just connected with an intimate part of us. And there was some spiritual component to it. So fast forward now as a laryngologist, I was making that connection and realizing, wait a minute, that's so weird that maybe I had some inclination towards laryngology even as a child. So I looked it up biblically, and the word soul is nephesh in Hebrew. And that word in the Bible is referred to over like 700 times.
Mm.
And a lot of the references are like, as the deer pants for water, as my soul pants for the Lord. And like, that's an appetite, right? So eating, the Lord breathing air into us. So nefesh was used into our souls. Nefesh was using that. So breathing in essence, and then speaking. I guess they were talking about how Job cried out for the Lord, like his soul cried out for the Lord. And so that was really cool that all three, breathing, speaking, and swallowing, or appetite, eating, were all incorporated biblically into the word nefesh, the Hebrew for soul. So I thought that was great. Like the core of your soul can be considered your voice box, since it is referenced in the Bible that way. So I thought that was the perfect way for me to refer to it. Also, I mean, like I said, the voice, you pick up the phone and the other person on the other line says hello. And if you've spoken to them before, 9.9 times out of 10, you're going to be able to identify that person. So without even seeing their face. So I think that's amazing that the voice has such a specific characteristic, so unique, so just yours, that
Yeah.
the way that you pronounce things, the pronunciation, the intonation, the inflections, the voice itself, the resonance, the characteristics of it are yours.
Yeah.
And you're identified by it. So it is kind of like your soul. It's you, it's your identity. So
Yeah.
that was my connection.
Welcome, Angela Turner. She said she loves that explanation, and so do I. And I was
Thank
thinking,
you.
I feel you on that, because it is, and like you said, I'm glad that you have those biblical references. Might have to go ahead and put that in my toolbox, because
Yeah.
when I give my little spiel to new clients, I start with the voice is the mirror of your soul and the soundtrack of your spirit.
Oh,
And I
that's good.
talk to them about picking up the phone, and the reason that you can hear if something is wrong with someone, even if you can't see them,
Right.
and we get so much information, but the voice to me is such a beautiful thing, which is why I was like, I have to have her on here to talk about this. I call myself a voice nerd. And
Me
what you
too.
said, it does. It definitely resonates with me greatly. And with that said, so when I say your voice matters, that's what I wanted
Yes.
to say with this episode. I feel like that's the intention of this. What does that mean when I say those words?
It matters, I think, more than we give it credit for. And so what I find interesting and what I like to impart on my patients is, okay, there are things that are easily fixable, that are surgically fixable, right?
Mhm.
Lesions are easy. But I don't think we give enough credit to the fact that a lot of psychiatric manifestations can be harbored in the voice box, and we need to really pay attention to that, because that tension that we've discussed before can be attributed to anxiety, associated stress. It's not only necessarily a compensatory mechanism for like overcoming a lesion that was once there or is there. Tension can be a result of, something that's going on. I've had plenty of patients come to me and talk to me about their voice, and it will turn out to be an all out, emotional session. And that's okay, because you need that release.
Yeah.
But I don't think a lot of people are in tune with the fact that oftentimes when you get choked up, people get choked up, and that is a laryngeal manifestation of what's going on emotionally. So we need to pay attention to that. Even swallowing, sometimes that ball in your throat. I mean, we talk about these things. I feel like I have a ball in my throat. I'm stressed out. I'm nervous. But we don't put the connection like, all right, maybe I should see a laryngologist about it, or, I need to see a speech language pathologist and go
Mhm.
to physical therapy. Yes, there's physical therapy, there's voice therapy, and there's physical therapy for the neck to get those muscles released, because
Yeah.
they can get tense too. And that's a treatment sometimes. So, your voice matters, and we shouldn't ignore it. And your voice matters to everybody else that's listening. Your voice also matters to you. So if you're ignoring or not paying attention to what's going on here, you may be missing out to, man, maybe I do need a little bit of a break, or, maybe I do need to pay attention to X, Y, and Z a little bit more, because it's really significantly impacting me.
You said a mouthful. And then let's talk about that as it relates to our community. So we
Right,
know that our voices matter because, too, like you said, that's how we share our stories.
right,
And with everything that's going on in the world, that's how we advocate for ourselves, to be able to
right,
speak up for ourselves. So
right,
it's taking care of yourself, and it's the instrument, and it's all of these things. But let's talk about the issues that we face. Why don't we get care, or the
right,
issues we face, well, and or the issues we face when we attempt to get care in the
right,
medical field?
right. So, whew,
Mm,
that's a loaded issue. Those are loaded issues to unload. I'm in Memphis. We're predominantly, the minority is the majority here. So it's really nice to see a lot of the African American community getting the care that they need. But is it enough? I don't think so. There certainly isn't enough awareness created in regards to voice care. And I mean, that's voice care is just scratching the surface, but I will stick to
yeah,
voice care because I could go on and
yeah.
on. Um, you know, Black people will not go for preventative voice care. A lot of my patients that ultimately do seek care, whether it's an airway problem or a voice problem or a swallowing problem, is a lot. It's manifested where it's like very advanced. And I think the issue is because there's not a lot of education that goes on about it.
Hmm.
And then to boot, the access might be a little bit challenging. And then just having an understanding of it, because 9 times out of 10, you're hoarse, it'll get better. Don't worry about it. Just give it a couple of days, make those home remedies, those concoctions, and then you'll be fine. Um, but the fact of the matter is we need to treat. We need to get seen, and we need to evaluate, diagnose, and treat, because there are other factors that could be contributing to. It's not just hoarse, it's going to go away. One patient in particular had papilloma, and let it go for years, to the point where it wasn't just hoarseness anymore, it was airway obstruction, and then understanding, papilloma, and the transmission of papilloma, and it's just challenging to kind of address those circumstances, because not a lot of people understand it or even know about it, and know
Yeah.
it's related to asthma as well. So
Hmm.
um,
Talk to them a little bit about papilloma, or some of the growths that you can find on
right.
the vocal cords.
So papilloma is a disease of the vocal folds, really the entire upper respiratory tract. But the main kind that I specialize in is the ones that predispose to laryngeal papilloma, and it's caused by the human papilloma virus. There are multiple variants of the or subtypes of the human papilloma virus, and there's some that predispose to what we call recurrent respiratory papillomatosis, or RRP. There are two types. One type is the juvenile onset. So some may present with, raspy voice, that may eventually progress to difficulty breathing in early childhood. And then there's the adult type, where you just any adult, your 30s, 40s, may present with sudden hoarseness, doesn't go away, may become obstructive and become an associated respiratory issue as well. The treatment for it is surgical. There's no medicine that you could take to treat it. The cause of it is questionable. For the juvenile onset, it's thought to happen from vertical transmission, is what we call it, but basically from the mother passing through the birth canal of the mom. You may get infected that way. For adults, it may be sexually related, or maybe a dormant variant that, became awakened in the adult onset. So, but both of them are treated in the same way. They're both surgical. There are some new treatments that are on the horizon. I'm actually just got approved for a clinical trial for one of them, so I can't talk about it in too much
Okay.
detail. But there are some medications that we are actively testing to try and eliminate, or if not eliminate, then reduce the disease burden so it doesn't come back so quickly. But everybody's different. Everybody's disease burden is different. Everybody's, need for surgical intervention and intraoperative holidays are all different. Every patient is different. So,
So is there anything that you feel like we're more prone to as a culture?
that's a good question. So we don't know, to be quite honest, and that's so. I have one paper that I'm doing research on, looking at disparities in papilloma, and the numbers are so little, but that paper does show that African American people, kids, the study was in pediatric population, are more predisposed to papilloma, more so than any other ethnicity. So there's still more work to do. For that particular disease, they just started a database. So we're hoping to get more information about papilloma and how it affects various populations in the near future, because we need that information. But truth be told, for laryngology in general, we do not have good disparities research. And so that's what triggered me to kind of start with the papilloma study to see how that affects the African American population. So, but stay tuned, because that's something that we're definitely going to investigate, is disparities in laryngology and laryngological diseases. So
Yay, let me know when you're ready to talk about that. I feel like
yes,
with everything that's going on, I'm almost motivated to go back to get a terminal degree so that I can contribute to the research for our population as it relates to voice. It's
right,
just the more you know, and the more I learn about advocacy, it's like, oh gosh,
right,
there's work to be done.
a lot of work to be done. And COVID, unfortunately, really, that really uncovered a lot of the need for the advocacy for disparities in medicine. It's really sad.
All
So
right. Before we jump into the COVID talk, let's talk. Let's see. So Jackie Stinnett here. She says, "Hi, Dr. Stinnett. What causes ulcers in the mouth?" Good question.
that is a good question, Mrs. Sinette. That's my mama-in-law. I'm not going to act all formal, but yes. So there are a number of things that can cause oral ulcerations. There can be the most common ones are oral ulcers or aphthous ulcers, or also known as cold sores. Aphthous ulcers can also be autoimmune related. So any ulcer, if they're recurring and they go away, but if they're extremely painful and becoming more frequent, then I would get them investigated, because you want to make sure that they aren't associated with an autoimmune disorder. But oftentimes they're just your run-of-the-mill cold sores. But other things you can consider are, herpes virus infection, and then, cancer, worst case scenario. But if they relapse and remit, then it's probably not cancer. It's most likely either an autoimmune or just infectious cause, or trauma, a burn, something like that.
That's true. Oh, and so I'm sitting here and I'm pulling it together now because we need to have the COVID talk.
Okay.
Um, what have you seen as it relates to COVID? And there's the talk about long haul. Can we talk about that for a minute as it relates to voice disorders?
Yes. Yes. So the long haul is very interesting, because it's kind of this nebulous, we don't know what the long haul. If you had COVID and you have these symptoms that are persisting, then we will attribute it to the long hauler syndrome. So, a few interesting things that have been brought to light is this post COVID vagal neuropathy. And that's just a way of describing the nerve to the vocal cord possibly being impacted by the COVID infection and causing some sort of weakness to the voice box. So I saw one patient that happened to. Um, so that was interesting. I think she regained spontaneous function of the vocal cord and now just had some compensatory mechanism that we're working through. So that's one. The other thing is long hauler syndrome, I guess, residual pulmonary issues and impacting respiratory support. And that certainly could have an impact on the voice as well. And so there was I don't know if it was a study, but at any rate, there was a group, uh, not in the United States, it was overseas, that started implementing these group therapy programs for post-COVID patients that had some hoarseness. I think they were opera singers, and they
Mm.
did this unloading technique of therapy in a group session, and they noticed a marked improvement in their ability and their symptomatology and their ability to sing. So, I spoke to a few speech language pathologists. I'm curious to hear what you think about it, the whole group therapy concept, because in theory, you don't know, what is going on with the vocal folds, and you're just, I guess, assuming that there's this uniform therapy that's going to work for everybody. And in the post-COVID era, you're busy, I'm busy. So is it fruitful? But this paper says it was. Like, these opera singers noted marked improvement as a result of this like group therapy for COVID.
I can see that happening in the sense that most people have issues with carryover, right?
Yeah.
We have that problem because well, and I just had this happen this morning. Most people want a quick fix. They want a shot, they want a
Right.
tea, they want a pill. We're going to talk
Right.
about that as we jump into vocal hygiene.
Right.
But they don't know how to integrate the skills they learn in terms of resonant voicing,
Right.
things like that,
Right.
into their everyday lives. And they're good as long as we're doing one-on-one sessions. But then I have one lady that's like, what do I do when I'm out walking my dog and then I see my neighbor? How do
Mm-hmm.
I interact? So I feel like it's functional. There's
Mm-hmm.
definitely something to be said for the functional use of it. And then I think accountability. And it's
Mm-hmm.
almost like that feeling of peer pressure, because as you see your counterpart exhaling in something, I'm in my voice breathing mode, but as they're doing well,
Right.
and excelling in something, then I feel like it's motivating in a
Right. Right.
sense.
Right.
And I would have to read more about that, but I've actually done a small group, and I played around with it with two clients who were open to it, and
Okay.
they really did well, and they gave each other feedback. So I didn't really have to say, they would just say, hey, can you try it this way? Like, they were very invested in it.
That's neat. That's
So I
great.
can see that happening. I can see
Yeah.
it being a benefit. However, when it comes to muscle tension dysphonia, or you're working on specific things, I think that one-on-one is still necessary. I don't think
Right.
it should all be group,
Right.
but I think there's a benefit to it.
Right. That makes sense to me. I
Yeah.
think, yeah, they could probably be one introductory group session. And I think the buy-in there is good, because if you see other people there doing
Yeah.
it, a lot of the times we talk about the buy-in for voice therapy, because for me as a clinician, obviously I believe in voice therapy, but if a patient is skeptical, I have to do a lot of work to say, look, if your Achilles was torn, you would go to PT for that. Or if you had a hip replacement, you would go to PT for that. So this is the same concept and of the same level of importance. And so sometimes it's hard, and there's very few that have a healthy dose of skepticism. Um,
Healthy is the operative word.
right,
And I think a lot of times too, when that happens, the laryngologist will try to at least get them to come for one session, but
right,
some people will stay, but then others are like, I got my one session,
right,
so
right,
I'm
right,
out.
right. And that was the eval. It wasn't even the therapy. You're like, you didn't even get to the meat and potatoes.
Oh
So,
yeah. We have a quick question from Andre St. Victor. Can we suffer from what is it? Tonsils calcification?
yes, that's my dad.
Oh,
No one
hi.
would know, but so yes, so the answer to that question is, it depends upon the cause of the tonsil calcification. There are things called tonsilloliths, though, and those are tonsil stones. I don't know if you've had them, Shuli, but sometimes we get tonsil stones, and you may get them in your mouth and be able to just look at them and see them. They're kind of gross,
They are gross.
but they're normal. Like
Mhm.
that's just your body's way of just getting the debris together and then getting it all out. So, that's I guess a form of a tonsil calcification. Anything other than
Mm.
that, like a firm tonsil or an enlarged tonsil, I would urge to probably get checked out and maybe consider either at least imaging, if not a biopsy, because you certainly don't want to miss cancer, especially in the setting of human papillomavirus.
For sure. So at what point, like you said, should you seek help? So if you have this amount of tonsillar debris, or is
Yeah.
it not a problem? I mean, you can have a lot and it can still be okay.
Correct. Yes. The
Mhm.
indications are if it is significantly impacting your quality of life, like halitosis, or you're gagging significantly, those would be the indications to take the tonsils out. That's the treatment for the tonsil stones.
Yeah.
So,
So Marion, okay, Marion, I do not want to mess up your name. If you know her, then you can help me. Is it
Abu
Abuyared?
Yared. Abu Yared.
Abu Yared. Group therapy sounds interesting and fun. Had never heard of that with a voice therapy. You should advertise a voice boot camp. Yeah, a voice boot
Yeah.
camp would not be a bad idea for
I
sure.
think I think that was probably what they called it in this paper, actually, that I read. It was a form of voice boot camp, but like Lee Silverman therapy for Parkinson's, and I don't know if there's another one. I forgot what it's
Speak
called.
out. That's what I'm
Yeah.
certified in speak out.
Okay.
I like that when go on record for saying it. It feels a little more healthy
Yeah.
for the voice. Yeah.
Yeah. I've never seen and I don't think Amy is certified in Lee Silverman or anything, in regards to Parkinsonian voice therapy training. But yeah, if you do teletherapy, then you could capture this population.
Hmm, something something to talk about
Right,
offline, but
right,
definitely
right.
we are doing teletherapy and there is a need, and I feel like teletherapy has given us access
Right,
to people who live in outlying areas. I know specifically in the Houston area and surrounding areas.
right. Here too, we've been able to, with COVID, I think my clinic was an easy transition to telemedicine.
Mhm.
I mean, you could just, like we said, the voice is just so easy to listen to and diagnose. And you're like, oh, maybe your cord's out or you have glottic insufficiency, or something that you can hear and diagnose and then plan the treatment for whenever they are able to, or call them in urgently because you have stridor, So things that you could just see and hear and diagnose for laryngology standpoint, telemedicine was pretty good.
That's yeah, the future. We've had
Right,
to figure out so many things on the fly.
right.
What have you learned during this time that I don't know that you thought that medicine or that we weren't capable of, but has proven to be very beneficial or good in the way of helping our patients?
So, you know, we in ear, nose, and throat as a specialty, we scope a lot. And in laryngology, I scope every one of my patients. And it's interesting because I did not wear a mask before the pandemic while scoping my patients. I don't think any of us did really, before the pandemic. And
Yeah.
you think about it and you're just like, wow, that is a public health issue. Like we should have been probably doing that from before. So, the fact that we were able to implement that seamlessly, and I think the literature doesn't support a lot of particulate emission when you're doing a scope exam, but you get that one gagger or that one
Mhm.
patient that like coughs quite a bit, and that's it. You're getting particulates emitting in high speed. So,
Mm.
wearing the mask, and I think there's a few institutions that documented a new mask for the patients, and you scope basically through a hole in the mask. I haven't done that, but I am wearing a mask when I do scope my patients, and I think that makes a significant difference. In regards to patient care, you're protecting yourself and you're protecting the patient. So the other thing is the transition to telemedicine. That was seamless. Like, we did it and it worked. And now if a patient lives far, because we have a lot of patients from Arkansas, Mississippi, mid Tennessee that can't make it, or they're have a lot of comorbidities and don't want to come out because of COVID. So I just see them via telemedicine, and then we come up with a treatment plan and move from there. So just being, very dynamic, adapting quite well. And then, I mean, one of my colleagues, Miriam Van Mersberg, and we were talking one day, and we're like, we need to fix this because laryngologists, speech language pathologists, we love the arts. We're, musicians or musician files that love music, so we're like, we got to do something. And we're like, let's do a study. And we applied for a grant and got funded. And now we're looking at particulate emission in singing, speaking, and breathing, kind of in an act to help support the paucity of data that's out there, because there's not much data. It's not uniform, to kind of help figure out how these particulates behave with these various, behavioral tasks. So we just launched our first week of participants. There's so much data. It's going to be great.
So then we have to talk about this, because that has been one of my things too, just thinking about respiratory droplets. We had all of these different conversations.
Right.
So you're definitely going to have to come back at some point when you can talk about these things and give us some updates to let us know what we can and cannot do, like legitimately, what the evidence tells us about these droplets. Because I think about when you're having that conversation with a person and they accidentally just kind of sputter on you anyway. Just imagine how many times that's happening when we don't even see it in a very minute kind of way. I'm like, now we're thinking about it all the time.
Right. The news, the whole, you're a kid and people used to say, well, they probably didn't say it to you, but I used to get people telling me all the time, I want the news, not the weather. And you're just like, oh. So super emitters are a thing. Super emitters can be considered COVID spreaders. It all depends if they're carrying the virus. So, those are the thing that we're interested in looking at, like who's a super emitter and who is not, and what predisposes somebody to be a super emitter. I know surgically, for me, my African American patients in the OR have so much saliva. It's like, and this is another study that I may want to do as it relates to COVID, because they have a significant amount of just salivary production intraoperative.
Really?
Yeah, it's interesting. So I'm like, is this related? Is there like an ethnic, trend towards saliva production and maybe particulate emission? So we'll see.
Yes, do the studies. We need the information. And of course, I'm fascinated. I don't know if you all are listening, how you feel about this, but I'm absolutely loving this conversation. So then let's talk about something that, from a functional perspective, for vocal health, we've talked about all the problems that you could have. We've talked about warming up, but let's talk about vocal hygiene, vocal health in general. What's the information? What are some things that people should be doing and should not be doing?
So water will always be the be all end all. I mean, this superficial lamina propria is a part of the vocal folds that is just very flowy, and the vocal cords themselves like to be coated and not covered with thick secretion. So in order to allow those secretions to move and to flow, and for your vocal folds to be coated beautifully, like in that TikTok video, shout out to Miriam's vocal cords, you need to drink an adequate amount of water. And so the things that you need to be mindful of when you are, considering adequate hydration status is you want to, look at your caffeine consumption. I'm not going to say don't drink coffee, but I am going to say don't drink coffee.
Yeah.
But I drink coffee too. It's challenging to balance it, but you want to be aware of that. Like if you're dry, dehydrated, you want to cut back maybe on your coffee consumption and go up on your water. Your urine, you want to make sure your urine is a nice, clearer color, nice on the clear side, not on the amber side. And that is a good indication that your hydration status is adequate. Allergy season, Lord.
Mm-hmm.
So any underlying issues, if you have reflux, if you have, heartburn, um, even silent reflux is a thing.
Mm-hmm.
So any symptoms, throat clearing, things of that nature that may be indicative of some extra esophageal, meaning outside of the food tube, causing irritation to the larynx, you want to get that addressed. And there's some literature to show that you can start, medication for reflux prophylactically for patients that have you know, ambiguous symptoms, not a significant amount of voice changes. But for me, if you're a professional voice user and you are having any symptoms, I highly recommend just get your voice checked before starting any medication.
Mm-hmm.
You just want to make sure that you're not misdiagnosing a lesion that a reflux medication is not going to treat. Right. But in the event that you do have heartburn and you truly do have reflux, you want to make sure that's well controlled. So diet modification, you don't want to be eating acidic foods, fried foods, spicy foods. You don't want to eat too close to your bedtime. You want to make sure that you're sitting up at least 2 to 3 hours before you go to bed, to minimize any nighttime nocturnal reflux. The other thing is, don't put a Band-Aid on your dysphonia or hoarseness. So
Yeah.
Vicks, Halls, anything with menthol, what is that spray? Chloroseptic, are all Band-Aids. Like, they're false senses of security that are going to make you believe that you could probably sing, scream. Steroids, don't even get me started. That
What
you
do you think about Singer's Secret?
Is that pectin?
I think I'm not sure what's in that one, but that's what a lot of singers talk about because, of course, my specialty is more speaking voice, but I've
Right.
heard that a lot. Singers, it's a throat spray that a lot of singers talk about.
So my husband used to use one. I can't remember the name of it. And I think it had green writing on the bottle. It was a spray bottle, and the fluid was like pinkish.
Okay.
But at any rate, if you look at the active ingredients, pectin is fine. So the one my
Okay.
husband used has pectin in it, and that is I think it's a carbohydrate that you find on apple skin, but it essentially is it coats the vocal folds, instead of menthol or like any type of numbing or topical anesthetic that numbs your throat and makes you think that you could go for days singing when
Mm-hmm.
you really could have a hemorrhagic vocal fold vocal fold hemorrhage by causing that trauma inadvertently and thinking you can do what you shouldn't be doing. So
Yeah.
the pectin is fine. Throat coat tea is pretty good too. I think it has some ginger and things like that in that. Any tea really is pretty good, just to soothe the throat.
Yeah.
Um,
Look, as long as it's not caffeinated, no heavily caffeinated tea is pretty much natural. I'm like,
right, right. I agree. And I think, in particular, the other side of it, like allergies,
mm-hmm.
though medications like Zyrtec, they're all going to have a certain component of drying. Like they all dehydrate, but you got to take that. But if you take with the Sudafed, like anything with a D, that is going to dry you out.
Mucinex D.
Yes.
That Mucinex D, it's doing its job for me right now. I'm saying that I'm the choir over here.
Well, but if your physician says that you need to take it, take it. But if it's
Mm-hmm.
drying you out, maybe have a conversation to see if there is any other alternative or if you could try it without the D. That dries you out quite a bit. So sometimes the medicine works well even without the D, but some people need it. So I'm not going to argue against that, obviously. So, and then getting your voice box checked. I think it's so important to, as a professional voice user singer, even if you don't have any symptoms, to get a baseline exam and get checked annually, just like we do for the rest of our body. I think that is important for voice users. I think mental health checks are
No.
important, and they should be considered, annual
Yeah.
checks physically. The way that we do physically, we need to do it mentally. And for the voice, if that's your instrument, you should do that annually too. So I think for vocal hygiene, those are all important components.
Yeah. What do you think about steaming or using a humidifier to help with moisture?
I love that. I think that's
Yeah.
great. Make sure it's clean. I first I had a humidifier and I was like, what is this? Like, because I never had one before, and I was like, this is disgusting. But make sure it's clean. If you could use the you don't have to necessarily use the heat one. You could use the cold steam humidifier. I think that's fine. Personal preference. And then they have the personal ones that you could wear around your neck, which is pretty cool. So yeah, I think that's great. I think humidification is awesome.
Yay. Okay, so we have a question.
Okay.
Shayla, well, I'll say Dr. Shayla Simon Ferguson says, what are the long-term effects on someone's voice who communicates with hearing impaired or unaided loved ones daily? Their voice is constantly elevated. What do you recommend to preserve their voice? Very good. She is an audiologist.
That's
So,
good.
Good
That's
question.
a good question. Yeah. You know what's interesting? I think in as just as important as the loved one who's caring for the person with the hearing deficit, the person who has the hearing deficit sometimes also screams.
That is true.
So I recently had a patient that, she had some tension. I was like, how's your hearing? No offense, but and she's like, actually, I can't hear that well. So, we got her ears tested because probably her tension is because she's screaming at people all day because she's thinking that she can't hear herself. So she has to project more. But at any rate, to answer your question, if it's impaired and it's unaided and they're unable to get it, I would say if you can get their hearing aids, any type of hearing aid, then that would be a great solution for both parties involved. However, if that isn't the case, there are some, I'm going to say it wrong. I want to say AC devices or things as such that we use for kids who have hearing impairment in classroom setting, where the teacher talks into the microphone and they have, hearing amplification that is directed into the student's ear. So that's an option. For other, easy things to do, make sure you try and talk into the unaffected ear if possible, which is probably challenging to constantly be doing that. A lot of the time, if it is an older patient, those patients typically have a harder, more difficult time hearing in the higher frequencies. So you may want to drop your voice a little bit to a lower frequency, and that may eliminate the need for having to speak louder. But I'm sure that after a while will also get fatiguing on the voice, dropping your voice down to a lower pitch as well. But the amplification, the FM system, thank you. FM system, exactly, is it. So.
But yeah, these are good questions. I was thinking about things that related to our community that we do, habits, behaviors, trends that could also have some form of an impact on our voice. So when you pair it with reflux, allergies, things like that. What do you think about waist trainers and their possible effect on
That's a good question. Oh man, that is a very good question. It certainly will have an impact on your respiratory support. So I guess in theory, that's the goal.
Reflux, possibly.
Right. I was going to say reflux as well, for sure. Even when we're sitting down and doing Zoom calls all day, just like the gravity and sitting, if we're not, protecting our posture, but that's giving you posture, I guess, in a way, but it's also squeezing everything in. So certainly reflux and respiratory support are going to be impacted. So I guess it's small durations. It might not be significant, but those things are not comfortable.
No, they're not. The things we do to look snatched.
I know.
Now, what about what about vaping and cigar smoking is also a trend. What do you think about those things?
Yeah. So I'm doing a study on vaping and the perception of voice, the perception of impact of vaping on voice. And it's interesting. People don't think that vaping has a significant impact on the voice, but there's some literature to show that on a molecular level, it does have a significant impact on the vocal folds. So anything that's going to be an irritant is going to have a significant impact on the voice, not to mention the risk of, carcinogenicity, specifically for cigars. I don't know if we have enough data to determine whether or not vaping does cause cancer, because a lot of the patients that vape once smoked. So was it the smoking, or was it the vaping, or did the vaping synergistically have an impact? So that's hard to, it maybe it's a confounder, so it's hard to tease those out. But yeah, certainly will have an impact on voice. And then, the cancer risk obviously is significant. So anybody who does vape, smoke cigars, marijuana, whatever the case is, if there's any inhalational irritant and an associated voice change, that is an indication to get checked immediately, because you want to make sure that there isn't any malignancy being harbored as a result. And hoarseness is an early sign of malignancy, especially people with risk factors such as those. So
Definitely. Okay, what about, this is no attack because I love the Lord and I believe in praising, but what do you think about charismatic praise and worship, hooping, um, choral singing, but
right.
our choral singing, the get down with the get down.
Yes. They are on my agenda. People to have a heart to heart to. And yeah, I've been at churches, and that guttural voice will do something to you, into your spirit, and the Holy Spirit will minister through that guttural voice. But there is a need for the implementation of some sort of vocal hygiene program, I think, for pastors, ministers, anybody who is in, the church, period.
Yeah.
So there's Dr. Sims out of Chicago. He does a lot of work with
Mhm.
worship leaders and pastors and things as such. And he's actually written a few papers on this topic. And I find it interesting.
I lost you just for a second. Can you hear me?
Am I back?
Now you're back. Okay,
Okay.
great.
And having conversations with some people in the church, you know, some people will not seek care because the thought is, if God wanted me to sing or lead worship or give the message this weekend,
Mhm.
then my voice would be okay. So there may be some spiritual component where people believe that they're not meant to be, and so I'm not going to seek care because the good Lord is going to take care of it. But I am a believer, and I respect people's beliefs, but I also believe that God is the great healer, and God has allowed us as specialists, in me in particular, I feel that God has led me to be able to treat that particular population. Because let me tell you, whenever I get a pastor in my clinic, I feel like, all right, I got to get this person ready to give the word. I just had a patient the other day, and he's going to do a revival in about 3 weeks. And I'm like, I need to make sure your vocal folds are ready, because I need you to get that word out. We are not, the enemy will not
Mhm.
stop you from getting this message out. So whatever we need to do to make sure that your vocal folds are intact, here is your vocal hygiene regimen, and then we'll do a little bit of voice therapy to
Mhm.
add to that. So I feel like it is an anointing to be able to do that, because obviously the voice, again, is powerful, and the voice is used to minister to people. The voice is used to preach the gospel. The voice is used to spread God's word. And so I can understand the spiritual component of it, but I think you also need to take into consideration who will be missing out on the important message that you have, or the important song that you need to sing, um, more so than, I don't think God would want you to not get that word out. You know what I mean? But
Yeah.
at any expense,
Yeah.
as long as it's aligned with his teachings. So,
That. Whew, that's a different conversation, but
right,
yes, for sure.
right,
For sure. Let's make sure, right. That is just not God blocking it. But no, let me
right,
stop.
right. We want to hear
But
it.
as we get ready to close out, tell people how they can advocate for themselves. You did a video about that today. So to make sure that they get the care they need, give them a couple of tips to first definitely see a doctor, right?
Right,
Have your doctor do a referral or whatever
right,
you need to do, but talk to them a little bit about advocacy? How can we ensure that we get the care we need
Right.
in the face of disparity and all these other things?
Right. So I think it's important to address your priorities. So a lot of the times with primary care doctors, that they're going to be your gatekeepers, right? They're going to be your home base and triaging you accordingly to see the specialist that you need. I think it's very important to be very clear about what your desires are. With a primary care doctor about what specialist that you want, and it's a collaborative effort, right? It's not a paternalistic medicine anymore. You're not being told what you need to do. You should be with your team, with your primary care doctor, deciding what is going to be the best step for you. They give you the options and you decide together what you need. So for me, being a professional voice user adds a layer of added layer of urgency in getting to an otolaryngologist, particularly somebody that specializes in voice, sooner. So, I believe that even when you do get to the otolaryngologist, voice is such a niche specialty that you will need to advocate for yourself sometimes, even with somebody who you would have assumed to be an somebody who could help you with your voice disorders. So if it were to come to that situation where you're not making any improvements, or they don't see anything on your exam, don't feel dismissed if they tell you, your voice box is fine, I don't see anything wrong. I would just understand, and you might need to do some educating. And we talked about the things that are affecting the voice box, not from a lesion or anything like that. There could be a functional component. And so just letting them know, sir or ma'am, I feel and I know, because I am a professional voice user, that there is something wrong with my voice box. And so if there is somebody that does specialize in voice, can you assist me with getting to them? And or finding somebody who does specialize in voice through the internet. So there's the American Laryngological Association that will list out laryngologists that and laryngologists are the doctors that specialize in voice, airway, and swallowing. It's a limited list because it's only the people who are in that association, but that's a place to start. And perhaps you can call and find somebody that can assist you through there and network through there. Because if you type in laryngologist, unfortunately, it's going to give you otolaryngologist.
Yes.
So it's going to be hard to kind of find somebody. But academic institutions, oftentimes, academic affiliated hospitals, you will find a laryngologist there, or the department will be able to help you find one. The ENT department there will help you be able to find one. So, but don't give up. I feel very strongly about particularly professional voice users. If there is something wrong with your voice and you're not getting the care that you need, or you're not getting a diagnosis, it doesn't mean that there's nothing wrong. So just be diligent about finding a specialist that can help you find the diagnosis, and then ultimately the therapy or the intervention that you would need to get better.
Yeah. All good things.
Yeah.
All good things. How can they find you?
I am in Memphis, but you don't have to find me in Memphis. You can find me at Instagram, the Voice Box Doctor. I am also the Voice Box Doctor on TikTok. And my email is thevoiceboxdoctor@gmail.com.
Very good. And you now have a YouTube, right?
I
You're
do.
starting, you're going to do some things. So
I
is
do.
everything the Voice Box Doctor?
It's Sandra Stinnett is my YouTube. I'm going to probably need you to teach me how to change it to the Voice Box Doctor, because I don't.
Okay.
I tried, but
Okay.
yes.
We'll get it done.
Okay.
All right. So is there anything that we missed that you feel like people need to know?
I think we touched on everything, but I do feel, I want to emphasize the importance of vocal health. Don't minimize it. Some things are just so easy to fix. And we don't want to neglect our bodies, especially during this pandemic. We want to be very diligent about being healthy, maintaining our health. And when you're doing these virtual meetings, just listen to yourself, take some focal breaks, drink lots of water, go for walks intermittently and periodically. Your voice is a muscle. and you want to treat it as such. Warm up, cool down, stretch it out, and just love your larynx. That's my hashtag. Love your larynx.
Mhm. That's a good one. I'm like, okay, everybody now put your hands on your voice box.
Circular massage.
Yeah, and say, I love you. Thank you so much. Thank you so much for coming to speak it with me. I think this is an important conversation. The theme for this season, this is season 2 of the podcast, and the theme is rise. And so we're rising in our thinking and in our living, and so in how we do everything. And until next time,
Yes.
make sure you go out and speak it. Ashe.